COVID-19, presented by UMass Memorial Healthcare and Spectrum News 1. I'm Bottary, and joining me is Dr. Dickson, CEO and President of UMass Memorial Healthcare. Now, we're at the beginning stages of what some predict will be the most turbulent period of this pandemic. Experts are predicting a significant increase in critically ill patients. Now, Dr. Dickson, is this what you're seeing across the UMass campuses as well as beyond?
It is, Anna, and this pandemic, like all pandemics, will have a beginning, a middle, and an end. And we're in the middle portion of it now. 2 weeks ago, we had very few patients with COVID disease in the hospital. Right now, today in the medical center and across the healthcare system, we have about 100 patients that have the disease, and 25 of them are on ventilators fighting for their lives.
And UMass Memorial has done a lot of surge planning. How confident are you that the organization has been focusing in the right areas?
I wish the 100 patients that we have now was the peak and that we were going to see a decline, but that's not what's predicted. We predict that we'll have 400 to 500 patients in our healthcare system with COVID disease within the next 2 weeks. And we don't have space today to be able to manage that number of patients. Our surge planning is focused on a couple of different things. First, we need ICU capacity. We've been able to double our ICU capacity from 120 beds to 240 beds. Second, we need med-surg beds, we call them, less acute care. And we'll have some here at the hospital, but the DCU Center Field Hospital is going to be critical for that. And then we'll need places for patients to go after they've gotten through the difficult stages of the disease to recover. And that's the Beaumont Hospital, which is right behind the building here, close to the university campus. That's 150 bed for COVID patients. You add those three things up, and we think we're prepared in terms of the surge that we'll face.
Now, do you think that the message has sunk in and that people are heeding the advice on social distancing and staying at home?
Yeah. I think mostly, but unfortunately mostly isn't enough when you're trying to stop the spread of a virus. So we still all go into stores and see people walking down the street that are walking close together without a mask on, and people that aren't decontaminating and washing their hands frequently. It doesn't take but a few people that are breaking the rules to keep the spread of the virus going. We need everyone focused on this every day.
And what is the biggest challenge that you've faced overall so far in all of this?
I think my biggest fear is that our people are going to get sick from this disease, our caregivers. And you know, that's the last thing we want to happen, is people that come in and work to care for patients to contract this disease. So we need to have adequate stores of personal protective equipment, the famous N95 masks, face shields, gowns, gloves, and it's been really hard to keep the stores up. To date, we've not run out of anything, but it's not been easy. We've had to go through all sorts of different channels to be able to keep the PPE stores going. And as we see more patients, we're going to need more PPE, so that will be a challenge.
And you are accepting donations, correct?
We are accepting donations at UMass Memorial Donations. PPE, you can put it into Google and you'll come up with a website where you can make donations. And we've been amazed at how the community has really worked with us to come up with different ways of making us face shields, N95 masks that they had for dust control and things. The donations continue to come in and we're very thankful for them.
Now, we've seen you jump in and lend a hand with your caregivers on the front lines. Tell us what that was like.
Yeah, the most important thing for me as a physician here that practices medicine is I don't want people to think that I'm asking them to do something I wouldn't do myself. So we have a tent for COVID patients that we are ruling out suspected COVID disease off the emergency department. That's the tent where I've been working in along with my colleagues in family medicine that have helped support us. And it's been an amazing experience, how people have come together. And you see these patients and they're scared, right? They're watching TV, they're hearing that people are dying and people are doing the death counts every day. And part of the job for our caregivers is to reassure them that, hey, 1 or 2% of patients that get this get really sick and do these things and try to keep your family from getting it. But in all probability, you're going to be just fine. And if you start to have more severe symptoms, we're going to be here for you and we're going to take good care for you. It's so hard to make that human connection with the patient behind the mask, goggles, and a gown. And one of the things I've coached my caregivers to do, and that I try to do, is make sure I make that human connection with our patients, because they're really scared right now.
And to that, what should people be doing right now?
Well, they should be doing what we're doing, Anna. We're sitting 6 feet apart. We're wearing masks because we're out in public. I saw you do your hands when you came in through the alcohol-based cleaner. I did mine. Disinfect the area before and after when we come in here, and not touching your face. And this virus does not penetrate the skin, right? If you get it on your hands, you're not going to get the infection. But if you get it on your hands and you touch your face, especially in and around your nose or your eyes or your mouth, that's how the infection spreads. So as long as you do these things, you're not going to get sick. And if you are sick, we're going to be here for you to take great care of you.
And now you and I are wearing these cloth masks right now, and that is what you're suggesting the general public uses, not these N95 masks that should be reserved for medical professionals.
Yeah, absolutely. These cloth masks or a homemade mask, you want to have 2 plies of cloth over it, not just the bandana. What that does is, as I'm speaking, I could be generating particles of virus if I were infected. These masks will block that down so that very few particles can be released. And very few particles could travel far. You'll see the reports that a sneeze can travel 29 feet if you try hard enough. What this is going to do is prevent any person that's infected from leaking the virus particles out onto surfaces. And that's very important. And it's protecting you also from touching your face, which is the most common way to get the virus.
And is there anything you want to say to your community or your UMass employees, caregivers?
Yeah, it's been amazing to watch our people come together and fight against this common enemy, COVID disease. You say thank you so many times, and what I would say to them is, I just love you for what you're doing, right? And there's no other word that can describe how much I care about our people and how thankful I am for them putting themselves sometimes in what is a hazardous environment. Healthcare workers are 3 times more likely to get this virus because there are so many more exposure points. And so we're going to work really hard to keep you protected, but I can't thank them enough for what they're doing.
Absolutely. So Dr. Dickson, some of our viewers have submitted a few questions that I also wanted to pass along. What treatment are positive patients given while they're in the hospital?
The primary treatment is good supportive care, which includes oxygen therapy. We've got a couple of clinical trials going on right now to try to find out which drugs may or may not be effective in treating this disease, but right now there is no proven therapy beyond good supportive care. That's typically an IV if people get dehydrated, and oxygen therapy to get them through the worst part of the disease if they get the viral pneumonia.
And what lessons have you learned from this pandemic that will improve our healthcare system going forward?
I think that there will be some good that comes from this, and it's hard to see that right now as the surge approaches us, and the hardest part of this whole pandemic is before us. Even in New York, they're a couple of days from the high point in terms of disease, the low point in terms of care. And what I'm amazed about is how much we can accomplish when we all work together. This city, the state, the hospitals that were one time competing are sharing information, best practices. We're sending test kits to other hospitals that need our help. And it's just been amazing how you could put up a field hospital in 8 days. Well, that would never happen if the state didn't support us, if the city didn't support us, if St. Vincent's Hospital didn't support us, and the people that volunteered. So, it's the good things that we're watching here have far outweighed the bad things at this point. This is a horrible, bad disease, and unfortunately lives will be lost. But I just hope we can keep that teamwork going to really accomplish more together as we go through this. The other thing that I think is going to change forever, and the genie is out of the bottle on telemedicine and virtual medicine. We're doing almost 4,000 visits a day, either by the phone or through a digital mechanism. And the patients now understand the power of digital medicine because I can see patients more frequently and check in when they're having problems. And now the doctors understand that. So I don't think anybody wants to go back to the way it was where every visit required you driving up, parking your car, paying for parking, waiting in line, registering. We're doing that all online now, and I hope that keeps on going as well, because that's a very powerful tool in fighting this virus and in taking care of our patients.
And as a doctor, doing this kind of through a video or Skype call, something like that, is this a learning curve for doctors?
Absolutely. In fact, we've paired up our older doctors, or more experienced doctor, with medical students who have donated their time and want to help. And they're used to using social media and how to online and how do you communicate, everything from what the camera angle is and talking to patients and helping document it into the system. So there is a learning curve, but I've been so surprised how great my 83-year-old mother is doing on FaceTime and Facebook and communicating with me and other caregivers and other people that she cares about, because right now this isn't the time to go see her 83-year-old mother.
And how will UMass Memorial be triaging patients between the hospital, the field hospital, and the COVID-19 care center at Beaumont to make sure that they're getting the level of care that they need? And if they do need to come back to the hospital, is that possible to do?
Absolutely. And so we start with all patients with suspected COVID disease being evaluated in the emergency department. This is a sneaky, nasty disease. It causes a little bit of symptoms in a few people such that they can spread it around unknowingly, and then severe symptoms in a small percentage on the other end of the spectrum. Everyone with a symptomatic suspected COVID disease needs to be evaluated in the emergency department. We can check an oxygen level, a chest x-ray if necessary. There's some labs that we follow, but then we start to move them to different areas. ICU for the sickest patients, DCU for those that are least sick and can get up and move around and take a shower, which you can do at the DCU, something you can't do in the hospital. And for those that are recovering, they'll go to Beaumont. At any point, people decompensate and get sick again, they'll come back through the emergency department to the hospital. We're reserving the hospital to take care of the sickest patients. And these other sites will, patients will move between them based on the acuity of the illness at that time.
And that DC Center, UMass Memorial Field Hospital will be opening tomorrow morning.
Be opening tomorrow morning. We're hoping not to take more than 10 to 20 patients over the weekend, just so we can work through all the kinks. But if needed, we'll be able to take up to 214 patients there. We've got 6 ICU beds set up there. We can ventilate somebody there if necessary, but that's not what its intent is. And it's really set up such that lower acuity patients can come there, they can move around, they can get a shower. There'll be some common areas because everybody there will have the disease and they therefore can't spread it amongst other patients. But if somebody decompensates, we'll be ready to stabilize them and then get them back to the hospital as necessary.
Dr. Dickson, thank you so much for your time and all the important work being done here at UMass Memorial Medical Center.
Thank you, Anna. I couldn't answer the